Good morning, everybody. Today's my topic is skeletal trauma. I will speak about bone fracture. Myself, Dr. Sandeep, JR2 Radiology. So, what is fracture? So, fractures are described in many ways. So, I'm going to discuss total six types of fracture. So, first one is the communication with the external environment. It can be either open type or the closed type. Open type is called as compound fracture, and the closed type is called simple fracture. Second, according to the anatomical location, whether it is intra-articular or extra-articular. Third is configuration, whether it's transverse, oblique, or spiral. And fourth, according to the displacement, whether it is angulated or rotated or tilted. Fourth, the position and the alignment of the distal fragments. And the sixth, about the classical names. So first, the open fracture. Open fracture is also known as closed fracture. Open fracture, whether the fracture fragment it communicate with outside or not. So the open fracture is also known as compound fracture. Here the bony fragment it penetrates the skin. So this is the open fracture or compound fracture. And the closed and the simple fracture where the fragment it remain intact and it is covered with the intact skin. So it's a closed or simple fracture. Then uh, then the fracture has been classified. Means there is a Salter's classification which involves the physis and the cartilaginous epiphyseal plate. So near the end of the long bones in still growing children and the adolescents. The damage to the growth plate during the growth may destroy part of all its ability to produce a new bone, thus preventing the elongation of the bone, which may lead to anatomical and functional deformities. So, according to Salter Harris classification, it includes five types. So, type one is the straight, or either it is known as slip fracture. The fracture plane passes all the way to the growth plate. We have seen slip fracture where the fracture line passes all through the growth plate. Then A is for above. So above is the epiphysis, where we can see the fracture, where the fracture passes most of the epiphysis and grows up to the metaphyseal region. Third, L is for below or lower. So it's below the epiphyseal region. Epiphyseal region. So in this, we can see that the fracture this passes to growth plate and extend downward towards the epiphysis. Then fourth is the through and through. TW is to or through and through. Where then nature of the fracture line. So this is the normal bone. First is the transverse fracture line. This transverse fracture line is perpendicular to the axis of the bone. Then it's second is the oblique. There's a oblique fracture line oriented obliquely across the bone. It's a 30-degree or more than it. Then spiral fracture, which move look like a fracture and looks like a spiral staircase. Then next is the multiple fragment, which is called as communicated fracture. Next, the segment has been displaced, so it's a avulsion fracture. Then there is an impacted fracture, the fracture with increasing longitudinal force applied across the length of the bone. Then next there is a torus fracture. In torus fracture there is no break in the cortex. There is only just remodeling. Last is the graceful fracture. Graceful fracture is just only a fracture or direct blow on either side of the bone. Next, the incomplete fracture. Fracture means the fracture line does not cross the bone completely. It predominantly occurs in the children. So the types it's a buccal or torus type. Here the cortex is buckled after in the distal radius. Means there is no any visible fracture, but the cortex had been buckled. So it's called a buckles or torus fracture. Next is the green fracture. Green fracture of the cortex is broken but only on the one side. So here we have seen this the radius where the fracture where only there is only one side there is fracture. Last is the bowing. Bowing means the bending of the bone. That the long bone has been bent. So here we can see the bowing of the bone. Next is the undisplaced and the displaced. Here the fracture fragment has been attached to it. So it's undisplaced files. And where the fracture fragment has been displaced, there is a wide gap between the bone and the fracture fragment. So the stable fracture when occurs when the piece of the periosteum is intact across the fracture line, they are attached, and the unstable fracture they are the grossly displaced. Next is the fracture displacement. Fracture displacement can be either dorsal side, palmar side, or on the varus or valgus, radial or the ulnar side. It depends upon the angulation of the distal portion of the bone. So next is the fracture rotation. Depends on the rotation of the distal fracture fragment in relation to the proximal portion. Next, there is a shortening due to overlapping ends of fracture fragment. Here we can see there is a fracture seen in radius as well as ulnar. This lead to the shortening of the limb. Next, subluxation. Subluxation means where there is a partial loss with the articular surface of the joint. In the joint, bone has not been displaced. It is within the articular surface only. It just get subluxated. While the dislocation means there is a complete loss of articular surface of the joint. So here we can see the subluxation. There is a widening of the glenohumeral joint space, and here we can see that middle phalanx has been completely displaced. So this is the dislocation and this is the subluxation. Next is the depending upon the part of the bone which is affected. First one is the diaphyseal part. Diaphysis is nothing but the shaft of the bone. Is known as diaphysis. Next is the metaphysis, the widened portion just adjacent to the growth plate. This is the growth plate, and the widened portion. This is the metaphysis. Next, epiphysis. Epiphysis, they are the end of the bone adjacent to the joint. So this is the it is the epiphyseal region. Next is the stress fracture. Stress fracture is due to because of repeated minor trauma. It appears as a sclerotic band across the bone. Here we can see there is a sclerotic band which is seen in the third metatarsals. So this is the March fracture. Then next most common site is the tibia. Here we can see the lateral aspect of the shaft of the tibia. It gets displaced. Displaced means there is a break in the continuity of the cortex. We can see the fracture. Next is the pathological fracture. Pathological fracture occurs in an abnormal bone, may be presenting feature in primary and the secondary bone tumors. Bone tumors. Here, this is the radiology area. Uh, this is a type of pathological fracture. It's secondary, the pathological fractures may also seen in osteoporosis, where there is a osteoporosis, the bone gets eroded. So this is a pathological fracture where there is underlying pathology is there. Next, there is a associated soft tissue injury. We can see here there is a elevation of the anterior fat. The fat is normally covers the bone, but there is elevation of the fat. Uh, because of some pathology. This radiation area it represents the fluid, and this radiopaque represents the fat. So here the anterior and the posterior aspect of the fat gets elevated. Uh, Here we can see the flat fluid level. This radiolution it represent the fluid, and this radiodense it represent the fat. So it's a flat fluid level. It is also called lipohemarthrosis seen on the cross table level suggestive of intra-articular bone injury. Then the stages of the fracture healing. So the fracture healing, first at the site of fracture there is formation of hematoma. The hematoma is converted into granulous tissue by invasion to cells and blood capillaries. After hematoma formation there is formation of soft callus formation. So the soft callus consists of the deposition of the collagen and the fibrocartilage which converts the granulation tissue into the soft callus. After soft callus there is a formation of hard callus formation. So once the deposition of collagen and fibrocartilage gets converted into granulation tissue, there is a uh, deposition of temporary bone collar around the fracture, unite the broken piece where the ossification occurs. These are done by mainly by osteoblast. Then after hard callus formation, there is a bony remodeling. So the small bone fragments are removed by the osteoblast, while osteoblast deposits spongy bone and then converted into compact bone. So this is at the day 1 where we can see the bicortic displaced fracture. Day 4 there is a formation of hematoma where we can see the dense areas. Day 7 where we can see the soft callus formation. After 2 weeks we can see the hard callus, and after 6 weeks we can see the remodeling. So these fracture fragments get united. Next, how to evaluate skeletal trauma. On plain radiograph we can see we can diagnose the fracture. Other than X-ray we can use CT scan where we can do 2D and 3D reconstruction. MRI is choice for injuries along the joints and the soft tissue. It includes the muscle or tendon. Ultrasound is to look for there is a vessel get compression, tendons or fluid. Then fracture by. So first, this is the Jefferson fracture. Jefferson fracture is fracture of C1 where we can see there is a fracture in the anterior arch of the C1 vertebra. So this is the Jefferson fractures where we can see the fracture also in posterior arch also. Next is the hangman. Hangman is for situ vertebra, where there is a. It's also seen mainly in judicial hanging. There is a hyperextension of the neck, which leads to the fracture of the pars intra-articularis region. So this is the hangman feature. So traumatic spondylolisthesis of the axis. Then there is a clay showers fracture. Here we can see the spinous process of C6 and C7 where we can see the fractures. So this is the fracture of spinous process of the vertebrae at any lower cervical or upper thoracic vertebra, classically at C6 or C7. The mechanism of injury is force hyperflexion of the neck. Next is the Barton fracture of Smith. How to differentiate between Barton? Barton it includes the intra-articular surface, where the Smith it does not include the intra-articular surface. Then the coalesce or the smooth. The coalesce it's the dorsal angulation of the distal bony fragment. So if there is dorsal outward stretch or pull of the hand, it leads to the fracture is the coalesce fracture. And the reverse of coalesce fracture is Smith fracture, where there is a palmar angulation of the distal bony fragment. Smith is the most dangerous due to location of the neurovascular bundle on the palmar side. It gets involved. Next is the Bennett fracture. It's also known as Edward Allen Bennett's. So Bennett is the mainly intra-articular fracture, base of thumb. So it's the base of the first metacarpal bone which extends into the carpometacarpal joint space. It's an intra-articular fracture. Next is the straddle fracture. Straddle fracture is the fracture of the bilateral pubic rami. Here we can see there is a fracture in the bilateral pubic rami. Here also we can see there are fracture lines. So this is straddle. Then pylon fracture. Pylon fracture is a fracture of distal end of tibia and the fibula. Here we can see the comminuted displaced fracture of tibia and fibula. This is the pylon fracture. Next is the aviator fracture. Aviator fracture is the fracture of the neck of talus. So this is the talus bone where we can see the fracture of the uh, talus bone, neck of the talus bone. Next is the Jones fracture. Jones fracture is mainly the base of the fifth metacarpal. So it's we can see here the fracture. This is the base of the fifth metacarpal is known as Jones fracture. Next is the calcaneal fracture. It is also called as lover's fracture. It is sustained after jumping from the window. It means for a jealous of lover's partner. Here we can see the fracture. We can see the fracture fragment, fracture line here. So this is the calcaneal fracture. Next, next we can classify the fracture is the oblique intraarticular fracture. We can see intraarticular means being a joint. Here we can see the comminuted fracture, but it's not involving comminuted fracture. And then there is a transverse fracture we can see at the base of the form. So intraarticular mainly Bennett's as well as Ronaldo. So Bennett's is just oblique fracture, and Ronaldo is comminuted displaced fracture, multiple fracture fragment. And the last is the transverse fracture. So the transverse fracture it is not including the intraarticular, so it's an extra articular type of fracture. Next is the Ronaldo fracture. Ronaldo fracture. Here we can see there's the oblique fracture. We can see in the uh, base of the first metacarpal. Then mallet finger. Mallet finger. There is a avulsion. This type of avulsion is because of small bony fragment is pulled away by the tendon. Here we can see the extended tendon. This tendon at the bony fracture. This is the avulsion. There is a fracture fragment which is pulled up by the tendon. Then next is the boxer fracture. Boxer fracture is mainly the fracture of fifth metacarpal, where you can see there is a fracture involving the fifth metacarpal. Pot fracture. Pot fracture is there is a bimalleolar fracture. Bimalleolar means where you can see the lateral as well as middle condyle fracture. Then the cotton fracture. Cotton fracture is mainly trimalleolar. This is the APB we can see in the medial and the lateral condyle fracture. In the posterior we can see there is a fracture of the tibia. So it's a bimalleolar plus the posterior fracture of the tibia. So it's a complete trimalleolar fracture. Then there is a Chopard fracture. Chopard fracture, there is a fracture dislocation to the intertarsal joints. So this is the Chopard joint. This is the talus. This is the navicular. We can see the normal line passing through the joints. So here in Chopard fracture, there is a fracture dislocation. There is the talus. It's navicular. We can see there is a disruption of this joint. Then next is the mass fracture. Mass fracture is the stress fracture of all the metacarpals. Where you can see the third and fourth metacarpals. These are involved. Then the lesion frac joint. So normally this is the normal lesion frac joint. In the fracture, the joint gets eroded. Okay, so it's called as lesion frac fracture. This is the overview of all fracture we can see. Jefferson is the Jefferson fraction is the Atlas C1. So we Hangman is the C2 vertebra. Nightstick is mainly direct blow, so it's a fracture of shaft of ulna. Police fracture is the extra-articular. This is a fracture. This is the uh, dorsal displacement of the distal radius, and reverse of it is the Smith fracture. Then the fracture of stellate fossa is known as Chauffeur's fracture. Barton fracture is the intra-articular fracture with subluxation of the wrist. Then there are many other fractures where we can see. Thank you.